My name's Kathryn Heiler. I'm the Director of the WorkSafe Canterbury Rebuild Health and Safety Program. And yet again, we are very delighted to bring you all together to talk about some issues that are very important at the moment across the rebuild. I'd like to thank ACC and Tri-X for co-sponsoring this event for our community down here in Christchurch across the rebuild. Again, I want to thank all of you for turning up, because as well as coming to hear some terrific people, it means that you have an opportunity to talk to each other and to network. And in terms of sending the message out and getting to know each other and having a community of interest across the rebuild, you in fact are the most important people in the room, so thank you very much. We are focusing almost exclusively on occupational health this morning. As you know, New Zealand has a fatality rate of around about 75 people every year. We've had a slightly bad couple of weeks here in Canterbury, so that's something to be mindful of and to think about those families who have lost people. But in addition to traumatic injury, New Zealand manages to kill approximately 600 to 900 people every year who are thought to die from occupational disease at work. Most of that is asbestos related, but the combination of dust load at the workplace is really a very significant hazard for us. If people smoke, the comorbidity associated with that is really quite significant. So in terms of a risk in our workplaces, dust is really right up there as one of the most, if not the most significant cause of occupational disease and indeed health. Of course, noise, manual handling and exposure to chemicals are also significant, but really dust and the kind of respiratory diseases and fatality that it causes is something for us to give a great deal of attention to. WorkSafe has, over the last 6 months or more, been funding a pilot study into silica dust levels across construction. That report is not ready to be released yet, but fortunately I'm going to talk you through in a moment just a couple of the key findings, which probably won't surprise you, but I guess what is disappointing is that it really is cause for considerable concern. So, how are we travelling? Well, I think what the pilot study showed without question is that our silica levels in dust across most, if not all, pretty much most of the activities that are conducted in construction are above and at times well above the recommended workplace levels. So while there was always an understanding that there was silica in our dust, what we know is that the quantity and the levels of quartz in the dust and the levels of respirable dust are way above levels, and that's of great concern from an occupational health perspective. So if anybody thought that grinding and cutting and drilling and basically working with a variety of different products that contain silica dust was not an issue, then I think that we can put that to rest. Now, what that will mean on a broader level, on a national level, we don't know, because we commissioned the Centre for Public Health Research in Wellington, who then in turn commissioned K2 to do the dusting, and in the end they will make the recommendations about what the implications are of those levels. But what we can say here is that the grinding, cutting, in particular linear board cutting, that's being undertaken both in construction and in construction-related manufacturing, anything to do with concrete has levels that all of us need to be concerned about. I guess of greater concern is that in many cases workers were not wearing any respiratory protection at all. And where it was worn, it wasn't fitted properly, which means that it really wasn't providing the level of protection that workers need. So if you see the two things coming together, we have levels in the dust that are high, that are above workplace standards, that are potentially the cause for concern. If we are relying on respiratory protection as our main form of protection, And the results of our pilot study are generalised, and we've got a lot of people not wearing any protection at all. And where they are wearing protection, it hasn't been face fitted properly, or they really don't understand why it's important for it to be fitted properly. A lot of people were also not clean shaven, and as I'm sure that our speakers will tell you, if you're not clean shaven, then your respiratory protection will not be effective. So we've got a lot of work to do. Again, disturbingly, if you have a look at our hierarchy of control, in order for people to wear PPE, they have to understand why they have to wear it. Often it's uncomfortable to wear, it can be hot, it can be annoying, it can get in the way, there can be a whole range of reasons why people don't want to wear it. But if you don't understand the risks associated with not wearing it, then the chances of wearing it are even lower. So the other thing that the study showed is that that workers were often not aware of the potential risks associated with silica dust. And in particular, they didn't understand the combined effect of smoking and being exposed to dust, which is really significant. It's highly significant for asbestos, but it also poses a considerable risk with respect to the exposure to dust and silica dust. So, although wet cutting and using water as a dust suppressant is seen to be best practice, the report in particular showed that there's a lot of slurry that's created by the use of that method, and of course people get that on their boots and on their clothing, and when it dries, it turns into dust again. So the need for other occupational hygiene practices at the workplace, including dust extraction measures, really needs to be considered very carefully. There'll be a whole range of recommendations that come out of this report, but as I said, the Centre for Health Research will be making those recommendations, and as soon as those are available, and we're hoping within the next couple of weeks, we'll be sending those out to the industry. So, look, it's a great piece of research because in many ways it confirmed It's a great piece of research because it provides us with better information than we had before, but it's a disturbing piece of research because it really confirms our concerns about both the levels of dust in New Zealand and the amount of work that we need to do among the workforce to ensure that our control measures are far more effective than they appear to be currently.